The face is divided into interesting watersheds. Right here at the third eye, there is a watershed that runs from here, inner eye, outside of the nose, outside of the lips, down to here. So basically that is the inner cone. The inner cone drains straight to the submental node. The rest of the face drains to the parotid, the temporal, and eventually into the submandibular and down into the cervical. So basically inner cone straight down, rest of the face laterally. Everything that you do on the face is stationary circles with zero pressure. Fingertip stationary circles, super easy. In order to start the face though, I come back and I do what I call an abbreviated opening, and some of you might like this because you can use this before you do any kind of MLD. 10 full pressure stationary circles to the terminus. And you can be seated for this one. Moving up, I've got my supraclavicular. 2 finger push release to the supraclavicular.
Do you mean both sides at the same time?
Yep. No, because they're separated by a watershed. So just 2 sides at the same time. I'm even resting my wrists on the pillow. Super easy. So 4 passes, push release, supraclavicular. Then we move on to profundus. Now this is tricky. Don't try this at home. No, don't try this in your massage room till you've got this nailed, right? Looks easy. And 1, disconnect. 2,
So because you can poke them in the throat.
circles with zero pressure. Well, the trick is to disconnect between these. Otherwise you end up dragging back around. You don't want to close the circle, you want to leave it open because I've just ignited the supraclavicular. So I've done my profundus. So 1, 2, 3, 4, press release for 10. 5, 2, 3, 4, soon to be 10. Water wheel. Full pressure stationary circles to the water wheel. 3, 4, 5, 6, 7, 8, 9, 10. At this point, we're going to move on to the face. Proximal to distal. Start with the chin. Stationary circles with zero pressure, 2 positions underneath the lip. 4 passes. Same sort of thing that you did with the circles at the wrist. All you're doing is making tiny stationary circles, straight opening down because we know that submental node's collecting this. 1, 2, 3, 4. I should also mention that there's a watershed straight down the centre. So this is what I saw once. In a classroom situation, instead of pushing away from the watershed, the students were pushing towards the watershed. What happened? This lady got a puffy lip because the fluid got stuck at the watershed. So they kept pushing in, pushing in, pushing in, pushing in. They were going the wrong way. Okay, so if you've already predisposed to a bit of fluid and you keep pushing in, you'll get a little bit of swelling there. So, stationary circles with zero pressure. The other thing you can do, stretch and hold. Active, passive, active, passive. Circles, active in the circle, passive in the hole. Active in the circle, passive in the hole. It's up to you. Now we come up to the nose. There's a few ways to do the nose, but this is really good for sinus. Which way have you been using? Because you've been doing that with success for your mum, yeah? Sweeps or stationary circles with zero pressure?
More circle.
Yeah. So you can do stationary circles with zero pressure, and the circles are opening straight down here, right? The other thing you can do is this. So guys, this is super light. You're barely touching the surface of the skin, but it's enough to lift to provide the capillaries with some space to drain. Back to stationary circles. Make sure you're draining straight down. Now, inner eye. We know that the inner eye splits. So the inner eye drains straight down, the outer eye drains straight out. You want to drain the inner eye? Finger pads, place them down, stretch, hold, release, stretch, hold, release. The other thing, micro sweeps. Just lift the surface of the skin. Vodda's Long Journey or the Fountain of Youth comes next. At the third eye, sweep the watershed. Jill Griffiths calls this the Fountain of Youth. It's kind of a cool name. Every client who knows that wants it. And you do 4 passes. And now, 1. Stationary circles with 0 pressure. 4 passes. The circles are opening laterally in the opposite direction. So these ones are opening that way, those ones are opening that way. Circle, 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 circle. Once you've done 4 passes up the face, tiny little sweeps under the eye laterally. This works, guys. It looks like it shouldn't, but it does. If you're really looking rugged in the morning, pop yourselves out of bed and give yourselves a few little sweeps, or hold and stretch. So connect, don't drag though. So when I say sweep, I mean sweep the surface of the skin without dragging. The other way, fingertip pads underneath the orbit of the eye. Connect, stretch, hold, hold, hold. Make sure you stretch laterally, hold, and release, just like this. So can you feel that stretch, Margaret? Mm-hmm. Release. Chickley, they do a whole other thing where you do these tiny little pinches so that you're actually lifting up the anchoring filaments. The stretch works the same way. You're lifting the anchoring filaments. You do the under orbit followed by stretch to the over orbit. Stretch, release. Stretch to the outer eye. Stretch, release. And then when we come to the forehead, stationary circles with 0 pressure in 2 positions, opening laterally in the opposite direction, same as the face. Just like this. So 4 passes, we know that that's our number, and then we slide down and we go back the way we came. So we ended with water wheel coming up, we start with water wheel going back. 10 full pressure stationary circles to water wheel, 4 passes to submandibular, 10 press release to submental, 10 stationary circles with 0 pressure to profundus, 4 passes push release to supraclavicular, and you end the routine exactly as you started, terminus, 10 full pressure stationary circles. And that, my friends, in a nutshell, is the face sequence. Right.